The global inequality I chose to talk about is maternal mortality. Every year, thousands of women die from pregnancy complications and childbirth. Even though most maternal deaths are preventable, they happen more often than one would think. Global research shows that maternal mortality remains one of the clearest indicators of inequality between countries and populations. Maternal mortality is defined as the death of a woman while pregnant or any complications that may result from childbirth. Most maternal deaths are caused by preventable complications such as hemorrhage, infection, and high blood pressure disorder when proper care is available. This issue is especially prevalent in the US because it shows a clear indicator of our nation's overall health and the efficiency of our healthcare systems. In the United States, Black women experience significantly higher rates of maternal mortality than white women. This video essay argues that maternal mortality is not just a medical issue, but a reflection of global inequality shaped by poverty, weak health systems, and structural injustice. While global maternal mortality rates have declined over time, large inequalities remain. A major global analysis from the Global Burden of Disease study shows that the vast majority of maternal deaths still occur in low and middle income countries, where access to emergency care is limited. More importantly, research shows that maternal mortality data itself is often incomplete. A study from Tholandi explains that maternal deaths are frequently underreported or misclassified in low-resource environments, which means that the true ratio of the problem may be underestimated. This research shows that maternal mortality is both a health crisis and a data inequality issue shaped by global systems. Maternal mortality is strongly shaped by structural inequality rather than individual behavior alone. In sub-Saharan Africa, researcher Musa Randiga found that many maternal deaths are caused by waiting for access to medical care, shortages in healthcare workers, and weak infrastructure. Similarly, anthropological research in Ethiopia shows that whether women give birth in healthcare facilities is strongly shaped by structural and economic barriers, not by choice. These findings suggest that maternal deaths rely heavily on access to the availability and accessibility of healthcare systems, which are found to be unequally distributed across the world. In Guatemala, research on Mayan maternal health shows how inequality is heavily rooted in history and social exclusion. Kosminski's analysis shows that Indigenous women experience higher maternal risk not only due to limited access to healthcare, but also due to discrimination and neglect within medical systems. This highlights that maternal mortality is also shaped by cultural and political histories, where certain populations are excluded from quality care. Even in countries with advanced healthcare systems, maternal mortality is not evenly distributed. In the United States, recent research by Joseph and colleagues show that mortality patterns are uneven across regions and populations. At the same time, studies on maternal death emphasize that many deaths are preventable if healthcare systems better identify risks and respond effectively. However, St. Pierre and colleagues highlight that gaps in reviewing the investigating maternal deaths limit prevention efforts. These findings show that even when data exists, failure can still prevent meaningful change. While researching this global inequality, a clear pattern emerges. Maternal mortality is not simply a medical issue. It is shaped by structural inequality, which results from poverty, weak health systems, and gaps in healthcare delivery and accountability. From sub-Saharan Africa to Latin America and the United States, the risk of maternal death is deeply influenced by where a woman lives and the stability of the healthcare systems that surround her. In an attempt to reduce maternal mortality, it requires more than medical solutions. It requires addressing global inequality itself and ensuring that all women have equal access to safe, respectful, and effective healthcare.